Assalamualaikum and good morning to Sir Zahar Rizwan and to all my friends. Today, my group will present about recreation. My name is Nur Nadira binti Ramli. My matrix number is 14DHF20F2014. Assalamualaikum and good morning to Sir Zahar Rizwan and to all my friends. My name is Nur Nadira binti Ramli. My matrix number is 14DHF20F2014. Today, I will present to you all about recreation. Okay, the introduction. Recreation is an activity done in leisure time chosen by individuals or groups without having to think about problems at work or at home. Recreation also performs activities that are beneficial in terms of mental and physical fitness in addition to being able to keep the body healthy and sharpen the mind. It also has poor and bodily value. This recreation can build fun and satisfaction. Recreation is also a leisure activity where the main purpose is none other than to relax the mind. Recreation is divided into two, which is recreation in indoor and recreation in outdoor. Okay, so this is example of recreation job scope, which is recreation in indoor like swimming coach, badminton coach, and futsal coach. Other than that is recreation in outdoor. Example, football coach, golf coach, or tower guide. Skills and understanding. Good planning and teamwork skills are essential for recreation sector assistants to thrive in employment. They must work with a team that includes recreation therapists, activity specialists, and counselors to arrange age-appropriate activities for a variety of clients. Because the work involves extensive interaction with clients, recreation assistants must have great communication and interpersonal skills to provide clear instructions and build positive working relationships with participants.
Assalamualaikum, my name is Muhammad Haikal bin Kamaluddin. My number matric is 14DHF20F2006. Today I will talk about introduction coach. What is coach? Number 1. To help an individual or group of athletes learn a skill and achieve a goal. Number 2. Coach create appropriate condition to simulate athlete learning. Number 3. 4 aspects must be present to be a coach, namely physical, technical, tactical, and physiological. Number 4. Coaching requires various skills such as planning, managing coaching, evaluating, communicating, making good decisions, and so on. Next, the challenge of being a coach. Number 1. Passion coach have a high level of passion because it is not easy to train athletes to become expert in a sport. Coach need to set realistic achievement standard so that it is not easy to give up when not achieving a goal. Number 2. Pressure on coach when facing big opposition. Number 3. Must have a firm stand to give introduction and make decision. Career branch. Number 1. School sport teachers. Number 2. Fitness coach. Number 3. Advisor in the field of sport. Number 4. Sport commentator.
My name is Siti Mara Mashita binti Abdullah. My matric number is 14DHF20F2015. Indoor futsal coach. Introduction to coaching in futsal. A futsal coach is a person with many abilities and skill. A futsal coach is a smart person and has of a knowledge. By having commitment, emotional towards sport, yourself and another. Next, futsal coaching acts of the professional. First, qualification. Have approval and qualification that have been renounced by sitting pretty before become a coach. Qualification by having to renounce sport science certificates and having level 2 coaching certificates. 2. Behave well. Practice as a coach from the aspect of behavior such as speech, mistake, and so on. Have good self-control and generally acceptable behavior such as not widely when celebration victories and monitoring defects. Number 3, discipline. Stay on time and prescribed and also comply with all the rules and law that have. Next, characters of a futsal coach. Number 1, sport intelligence. Coach need to be able to assess situation quickly and accurately. Skilled coach will go dog warrior experience as an opportunity to learn more about athlete and the sport of futsal. Maintain physical development. Number 2, someone who is preacher. Coach need to have a high level of fatigue because it's not easy to train athlete to specialist in a futsal. Number 3, knowledge. The coach must master the ruler in game. In addition, the coach must master correct to technician and must realistic standard of achievement so that not easy to give up. Number 4, emotional commitment. Coach needs social commitment with athlete so that many problems can be discussed together.
Assalamualaikum and hi to Sir Azharuddin and all my friends. My name is Nurul Atira binti Mustafa Kamal. My matrix number 14-F20F2030. Today I will present about tour guide. What is tour guide? Tour guide are responsible for escorting individuals and group of people on tours. They must find out about the groups and individuals. They will be guiding in order to select point of interest and provide commentary that is appropriate for their age and interest. What does a tour guide do? First, they receive information from tour manager concerning the age, interest, and other relevant information about the tourist. Next, conducting tours of cities, landmarks, local points of interest, historical sites, and other locations. Number 4, providing information about the area, including facts that may be of interest of the group. Number 5, distributing information and promotional materials of tourists. Next, answering any tourist question, ensuring that tourists adhere to rules and regulations of tour company and specific destination. Lastly, implementing emergency evacuation procedures if necessary. Next, tour guide may be employed on a seasonal, full-time, part-time, or volunteer basis by the following type of organization: tour operating companies, wildlife park, amusement park, museum, historical site, cruise ship, self-employed. Working condition for tour guide. Tour guide may spend a great deal on their feet throughout the day, as they lead tourists to and around sites of interest. This typically involves a lot of walking and may involve travel by other means, such as car, bus, boat, bicycles, snowmobile, and various others. The working hours of tour guide can vary quite a bit. They may work regular weekday working hours depending on where they work, or they may work during evenings and weekends. That's all from me. Thank you.
Assalamualaikum and good morning to Sir Zaharizwan and to all my friends. My name is Nur Nadira binti Ramli. My matrix number is 14DHF20F2014. Today I will talk about recreational therapies. What is recreational therapy? Recreational therapies seek to reduce depression, stress, and anxiety in their clients and help them build confidence and socialize in their community. Individuals who use our services become more informed and active partners in their own health care. Okay, so what they do? Recreational therapists plan, direct, and coordinate recreation-based treatment programs for people with disabilities, injuries, or illnesses. Work environment. Recreational therapists work in a variety of settings, including hospitals, nursing homes, and government parks and recreation departments. Most therapists work full-time. How to become one? Recreational therapists typically need a bachelor's degree. Many employers require therapists to be certified. Job outlook. Employment of recreational therapists is projected to grow 8% over the next 10 years, much faster than the average for all occupations. However, because it is a small occupation, the fast growth will result in only about 1,700 new jobs over the 10-year period. Related careers. Compare the job duties, education, job growth, and pay of recreational therapists with similar occupations. What recreational therapists do? Recreational therapists plan, direct, and coordinate recreation-based treatment programs for people with disabilities, injuries, or illnesses. These therapists use a variety of modalities including arts and craft, drama, music and dance, sports and games, aquatics, and community outings to help maintain or improve a patient's physical, social, and emotional well-being. Duties of recreational therapists. Recreational therapists typically do the following. First, assess patients' needs using observation, medical records, tests, and discussion with other healthcare professionals, patients' families, and patients. Second, develop treatment plans and programs that meet patients' needs and interests. Third, plan and implement interventions to support the client in meeting his or her goals. Fourth, engage patients in therapeutic activities such as exercise, games, and community outings. Fifth, help patients learn social skills needed to become or remain independent. Sixth, teach patients about ways to cope with stress, anxiety, or depression. 7. Document and analyze a patient's progress. And lastly, evaluate interventions for effectiveness. Recreational therapists help people reduce depression, stress, anxiety, recover basic physical and mental abilities, build confidence, and socialize effectively. They use inventions such as arts and crafts, dance, or sports to help their patients. For example, a recreational therapist can help a patient who is paralyzed on one side of his or her body by teaching patients to adapt activities such as casting a fishing rod or swinging a golf club by using his or her functional side. Therapists often treat specific groups of patients such as children with cancer. Therapists may use activities such as kayaking or a ropes course to teach patients to stay active and to form social relationships. Recreational therapists help people with disabilities integrate into the community by teaching them how to use community resources and recreational activities. For example, therapists may teach a patient who uses a wheelchair how to use public transportation. Therapists may also provide interventions for patients who need help developing social and coping skills. For example, a therapist may use a therapy dog to help patients manage their depression or anxiety. Therapists may work with physicians or surgeons, registered nurses, psychologists, social workers, physical therapists, teachers, or occupational therapists. Recreational therapists are different from recreation workers. That's all from me. Thank you.